Good evening, everyone. My name is Mai Hoang. I am one of the obstetrician and gynecologists. I work at Palo Alto Medical Foundation. I work at their Los Gatos office site, which is just down the street or across the parking lot from Good Samaritan where we are right now. Before we start with the talk, I'm just going to introduce myself a little bit to everybody. I grew up in Southern California. I did my college education at UCLA. Then I moved to the East Coast. I did my medical school in Vermont at the University of Vermont in Burlington. I did my training in obstetric and gynecology at Yale University at the Yale New Haven Hospital. So tonight, we're going to talk about healthy diet and weight gain in pregnancy. Feel free to interrupt me, ask any question as we go along. So at the end of the lecture today, what I hope is for you to be able to know and select what are some of the healthy food options, how much of it to have. We'll be able to figure out how many calories you and your baby need during the pregnancy so that you can have a healthy weight gain. We will also learn about what are some of the problems that can happen when you gain too much weight during the pregnancy course, before you went into labor, during labor, as well as the postpartum period. So in 2005, the USDA and the Department of Health and Human Services introduced a new food pyramid. This is very different from the previous food pyramid that we had in the past because it introduced the concept of physical activities. It's very important that we incorporate physical activities for kind of the healthy lifestyle. According to this recommendation, all men and women and children, regardless of whether they're pregnant or not, should have at least 3 ounces of whole grain a day, okay? That 50% of your grain intake should come from whole grain. They also recommend that we eat 2.5 cups of vegetable, 2 cups of fruits every day. Less than 15% of elementary school-age children are able to meet this requirement and eat this 5 cups of vegetable and fruit a day. So that's definitely an area for us to improve on, whether we're pregnant or have kids or not. They also recommend that we keep a total fat intake to 20 to 30% of total calorie. These fats should come from polyunsaturated fat as well as monounsaturated. They recommend that all men and women and children as well should have a minimum of 3 cups of milk product every day. We should vary our protein source, not just to have it come from meat, but also to come from fish, nuts, as well as peas. In 2011, they came out, again, the USDA and Department of Health and Human Services came out with this new model called My Plate. This is meant for you to remind yourself at every meal we should have fruit, vegetable, grain, protein, and dairy. This is not meant to tell you proportion of how much you should have, but it's more like a reminder that every meal we should try to get as much of this as we can. So now we're going to talk about the important macronutrient and micronutrient in pregnancy. The first thing that comes to mind is folic acid. Folic acid is very important. I'm sure many of you have heard of in different magazines and talking to your doctor and just searching on the internet that folic acid is very important. The reason why it's important is that if you take it before you get pregnant, it can reduce the incidence of neural tube defect by 36% simply by taking 400 micrograms a day. Neural tube defect is a structural anomaly of the brain and the spinal cord. So most common example that people hear about is anencephaly, so the baby doesn't have a normal brain structure, or spina bifida, where the spine is abnormally formed and the brain or the spinal cord tissue is prolapsing through. This is the second most common major congenital anomaly, and it occurs in 1.4 to 2 pregnancy per every 1,000. So it's quite very common. And as I said, it's one of the few intervention that we can do to prevent having this congenital abnormality. So before you get pregnant, you should take 400 microgram of folic acid a day, okay, for at least a month before you try to get pregnant. And during pregnancy, you should take 600 microgram a day. Iron is also important because it increases the red blood cell that is important for blood flow and oxygen delivery to the baby. We should get 27 milligram daily. The source for iron comes from meat, as we know, but it also comes from fish, spinach, dry beans, and of course you can get it through iron tablet. If you're going to take iron tablet, it's very important that you take it with vitamin C. Vitamin C, whether in the pill form, as orange juice or oranges, help your body to absorb the iron better. Calcium is important because it helps strengthen the bone and the teeth, not just for the mom, but also for the baby, especially for the baby as the development is happening. For women between the age of 19 to 50, we recommend that they take 1,000 milligrams every day. Source for calcium, of course, as we know, come from milk and dairy product, but also from dark and leafy green vegetable, as well as sardine and calcium supplement. Vitamin D, like calcium, is also very important. It helps bone and teeth strengthening, but it's also important for the skin and the eyesight. We should get 600 international units daily, and the source of that is sunlight. Fortified food that we can see, they always say in the supermarket that you can buy milk or soy milk that they always say fortified with calcium D. You can take it that way, or it can also come from fish like salmon. It's important that we eat healthy sources of fat, okay, healthy fatty acid. The most common thing that we think about is the omega-3 fatty acid. These are important because it helps develop the brain before and after birth. There are studies that shows that if women eat 8 to 12 ounces of fish per week while they're pregnant or during breastfeeding, that it can improve the baby motor function, also help to improve any behavior problem, and we can see that the effect lasts up until 14 and 17 years old. So when we talk about fish, we think about the mercury level in fish. Mercury toxicity can lead to motor, intellectual, and psychosocial impairment. So we want to limit the amount of mercury-containing fish that we're eating. Fishes that are lowest in mercury level are salmon, tilapia, cod, haddock, as well as shrimp. Those that are high in mercury level that we should avoid, whether you're pregnant or not pregnant, are tilefish from the Gulf of Mexico, swordfish, the king mackerel, and shark. Although most of us don't eat shark on a regular basis, so I think we're okay from that standpoint. So next, let's take a break and talk about listeriosis. Listeriosis is a foodborne illness that is caused by a bacteria called Listeria monocytogene. This bacteria can infect both pregnant and non-pregnant women. But among the pregnant women, they are at 13 times higher chance of developing this listeriosis than the general population. If infected for the mom, they have very little to no symptom at all. They might get diarrhea or some flu-like symptom, and that'll be it. But for the baby, it can have major complication. The baby can be infected, and it's what we call neonatal listeriosis. It can lead to miscarriages, preterm delivery, as well as stillbirth. So to avoid listeriosis, we want to avoid eating uncooked meat. We want to avoid eating cold meat, so such as hot dog, cold cut lunch meat, okay? We also want to avoid smoked seafood, even if they're refrigerated. We want to avoid unpasteurized dairy product, okay? And those are the most common way that we can avoid listeriosis. So here is a summary of a chart listing all the different vitamin and mineral that are important in pregnancy. It lists what they are, the amount that they are, why your body needs it, and where you can find it from. You can find a copy of this chart in the package, in the handout that you got. So let's talk about weight gain in pregnancy. In 2009, the Institute of Medicine recommend that pregnant women should aim for a certain amount of weight gain. This is to make sure that the baby and the mom will be healthy. So they recommend that for an underweight woman, and underweight is determined by the body mass index that is less than 18.5. For those women, they should gain for the whole pregnancy from the start until the end, they should gain about 28 to 40 pounds. They also said that at the end of the pregnancy, okay, toward the end part of the second trimester as well as the third trimester, the pregnant women should gain about 1 pound a week, okay? They recommend that the normal weight women should gain between 25 to 35 pounds, that the overweight women and the obese women should gain less. They should gain 15 to 25 pounds for being overweight and 11 to 20 pounds for obese. The rate of weight gain toward the end of the pregnancy should be about half a pound a day. Now, keep in mind that this is only a guideline, okay? This recommended weight gain is a guideline. It's meant for you to start the conversation, for you to talk to your doctor, for you to monitor your weight and see how you are doing as the pregnancy goes on, okay? As long as your baby is growing appropriately, and we do that when you come to the prenatal visit, as long as your baby is growing appropriately, even if you don't meet this recommended weight gain, it is okay. We do not recommend that you go out and try to gain more weight just to meet this guideline, because there's no evidence, no data to show that simply doing that will improve the outcome for you and your baby. So here is kind of the same information but in a graph format, okay? It tells us that the obese women represented by the pink line, okay, should gain less weight than the normal weight women represented by the blue line. The dashes are just the range of weight gain. Notice that most of the weight gain happened toward the second part of the pregnancy. So during your first trimester, if you are not gaining weight because you're nauseous, you're vomiting because of morning sickness, it is completely okay that you don't have to worry about the well-being of your baby, because the weight gain will happen toward the end of the pregnancy. So all of that weight gain, what that means is that in a day, all you need for your growing baby is about 300 calories a day. That's on top of what your body needs already, okay? So depending on what you eat, okay, 300 calories total a day can be met very easily. You can get that by drinking 1 glass of skim milk, by eating 1 chicken breast from KFC, okay, or eating half of a sandwiches from Panera or Subway. Okay. Here is a sample menu for a pregnant woman who is normal weight, who get less than 30 minutes of exercise every day, okay? How much they should eat in the different fruit category as the pregnancy goes on. Notice how as the pregnancy go on in the first, second, and third trimester, the total calorie that's required doesn't change significantly. okay? So you don't need that much for your baby. For twins, if you have twins, we recommend that you gain more than if you just have one baby, okay? Again, this is a recommended guideline only. And again, obese women should gain less weight than the normal weight women, okay? For a normal weight woman who's pregnant with twins, we recommend them gaining between 37 to 54 pounds. If they are obese, then they should gain between 25 to 42 pounds. It is very important that you incorporate physical activities in your daily life throughout the whole pregnancy, because physical activities improve the well-being for you during pregnancy. So it helps with the back pain, it helps with the swelling, it increases your energy level, okay? In addition, it helps you to cope in labor better. There's a recent study published in Spain this year that shows that women who exercise between 50 to 60 minutes each time, 3 times a week, that those pregnant women, when compared to the one who do not exercise, that in labor, the first stage of labor is significantly shortened if they are exercise, okay? So the first stage of labor is when you go from, your cervix being closed to 10 centimeters to where you're ready to push. That stage can be shortened by over 2 hours if you're able to exercise, 3 times a week, about an hour each time. So it's important. What you do, what you should do during pregnancy, what kind of activities level, kind of depends on what is your starting weight, how comfortable you are, did you exercise before you were pregnant, where you are in the pregnancy, or is there any problem, any complication with the pregnancy. But in general, we recommend 30 minutes of brisk walking daily, about 5 days a week, okay? We recommend that you avoid contact sport. Obviously, we don't want you to get injured and fall and hurt baby as well. We want you to avoid scuba diving because that's for oxygenation. We also recommend you avoid activities with a high risk of falling, such as riding horses, for example, okay? The goal is that you should stay hydrated and well oxygenated with whatever physical activities that you do. So what happens if you gain too much weight? Well, for the mom, before the labor process during the pregnancy, when you gain too much weight, you're at a high risk of developing gestational diabetes, okay? Your chance of having diabetes during pregnancy increased 2 to 10 times higher compared to if you did not gain a lot of weight or if you didn't start out being obese at the start of your pregnancy. You're also at a high risk of developing high blood pressure during the pregnancy. You're at a high risk of delivering your baby early, of having a C-section, as well as having stillbirth. During labor, okay, obese mom or mom who have gained a lot of weight in pregnancy face several difficulties. The first thing that they face is that it's harder for the healthcare provider to monitor the baby. So when you're in labor, we monitor your baby heart rate with a monitor that we place on your belly. So if there's a lot of excess tissue, it might be hard for us to monitor your baby. We might have problem managing your pain. So the anesthesiologist might have difficulty placing the epidural. And that the epidural might not work well for you during your labor process. They are also at a higher surgical risk, meaning that if they have to have a C-section, that it will take longer for us to operate on them. They will have a higher blood loss, a higher chance of infection, as well as blood clots. During the postpartum period, mom who gain a lot of weight, or if they start out being obese, they had a higher chance of keeping those weight and not losing them. The problem with keeping the weight that you gain during pregnancy put you at risk for developing chronic diseases later in your life, such as high blood pressure, coronary artery disease, as well as diabetes. They're also less likely to initiate and sustain breastfeeding. For the baby, well, what happens if the mom are overweight to start out with at the start of the pregnancy, or if they gain a lot of weight? Well, the baby are more likely to have certain birth defect. So obese mom have 1 to 3% chance of having baby with birth defect compared to non-obese mom. Also, it is harder for us to monitor or to use ultrasound to detect congenital anomaly for the baby if there's a lot of tissue, making it harder for us to do the ultrasound to recognize that there is an anomaly. So if there's an anomaly, we're more likely to miss it because of you being overweight. There is also a risk for the baby of becoming macrosomic, meaning the baby is larger than expected for where they are in the pregnancy. And with that, the baby can develop injury as the baby tries to go through the birth canal. Also, childhood obesity is a risk when the mom gains a lot of weight during the pregnancy, or if the mom starts out being obese. Well, some people may think that it's only going to be temporary, the pregnancy for a few months. Baby, once the baby is out, we'll take care of the baby and the baby will be okay. Well, that's not necessarily true, because what happened in utero does not necessarily stay intrauterine. So what that means is that in rats, we have seen that if we restrict their calorie, we don't feed them, okay? In the early part of the pregnancy, at the beginning of the fetal development, that the offspring rat, develop obesity as well as metabolic syndrome. Metabolic syndrome are high blood pressure, abnormal glucose testing, so kind of pre-diabetic, or abnormal cholesterol level. Now, if for the rat, if we restrict the caloric intake in the second part of the pregnancy, we find out that the offspring have higher chance of developing diabetes. Well, why is that? So there's this hypothesis called Barker hypothesis, and what he and his team propose is that what happened to the mom during pregnancy, okay, can change the environment inside the uterus. And this change in the environment can reprogram the baby metabolic ability, putting the baby at risk for chronic diseases such as diabetes, high blood pressure, or heart diseases. This is a very simplistic diagram that shows you there are different proteins and different hormones that are basically counterbalancing, telling the baby to eat and grow or not to eat and grow. Okay? It's the body way of preparing the baby for what happened when the baby is born. So for example, if the mom is pregnant, let's say at a time when there is very little food, like in a famine, which happened throughout history in the past and even now in certain part of the world, the pregnancy kind of sense from the mom that there's not much food. So then the baby brain changes, the hormone of the baby kind of changes, kind of prepare the baby so that when the baby is born, the baby will be prepared for an environment with very little food, okay? If that environment changes, if there's all of a sudden a lot of food, okay, that kind of imbalance where what the baby was pre-programmed while during pregnancy and what the body of the baby sense now that the baby is born, that discrepancy put the baby at risk where they can't metabolize very well, okay, and they are at risk for developing childhood obesity as well as obesity as an adult. And you can see this effect passing on through the next generation as well, okay? We see similar effect when the mom overeat during pregnancy as well. It's through a separate mechanism, but the theory behind it is the same, okay? So what that tells you is that there is genetic makeup for the mom and for the baby that kind of tell what the baby body will do, and those genetic things we cannot do about, okay? However, what happened during pregnancy, the input that you put to your baby to the pregnancy, that can change because your baby can change and respond to that, okay? So that is an area that you can kind of work on to make sure that the baby will not be at risk. Also, after the baby is born, there is some control. You can control what happened in the early life of the baby, controlling the nutrient deficiency or excess. You can monitor that so that to kind of decrease the chance of the baby of having diabetes as an adult in the future. So in summary, a healthy pregnancy involves a well-balanced diet of fruit, vegetable, lean protein with supplementation of folic acid, calcium, and iron. Remember that you are not eating for two, even though with all the raging hormone and everything, it feels like you are eating for two and you sometimes want to eat for two. Okay, but remember that your baby just need about 300 calories a day, okay? Remember to incorporate physical activities daily into your throughout the pregnancy, because that will improve the labor process and help you to have a healthy pregnancy. Lastly, remember that your weight gain, your nutrition during pregnancy can affect the future well-being of your baby, even as the baby becomes an adult. Thank you for your time. Any question you have for me? Yes?
So I guess asking this for curiosity. The baby inside the body, when it develop very slowly. But is it true at that point that the baby starts to grow faster?
Yes.
And at that point, would the mother's weight also grow?
Yes, yes. So that's back here where you see kind of this trajectory where you see the mom weight is very little and then the mom weight kind of shot up throughout the pregnancy. Kind of the same thing. In the early part of the pregnancy, the baby is not really growing sidewise. The baby is kind of developing all the important organs. So the brain, the heart, all the different organs. And then toward the end part of the pregnancy, that's when the baby starts to grow the weight. So that happened at the end. And it kind of reflects with the mom where at the beginning she's growing very little. And then at the end she gained a lot of weight. Not growing, sorry.
So it happens at about the 13th week?
Yeah. So starting in the second trimester. Second trimester is about 13 to 14 weeks, okay? And that's when you can really see kind of growth, the weight gain, the rate of the weight gain to increase. Yeah. Yes.
What about in other countries where they have different types of foods they eat? Does that affect these? I know, in Japan they'll eat raw fish, and here we'd say don't eat raw fish. And so how does that work?
Yeah. I think there's also a little bit the different as well as when we talk about Japanese who live in Japan and who eat raw fish. They have a different kind of immunity than we are, right? So just as, for example, men and women who live in developing country eating or drinking unfiltered water, they don't get sick. But we come there, we drink the water, we get sick. It's because our body has a different kind of immunity than to them. Okay, so I think that's explained why as well. For us here, this kind of recommend, this is based on the American diet, okay? There are variation between the different ethnic group, what they eat, okay? But the key thing, what's important is what you eat. the different vitamins. So whether, we eat sushi or we don't eat sushi, we still should get calcium, we should still get vitamin D. There's certain nutrient, vitamin, and mineral that we need to get throughout the pregnancy, regardless of what our diet is because of our ethnic background. Yes. Yes.
Another question. Now, I understand for ordinary people, if we take too much of some vitamin or mineral, it could be harmful.
Yes.
So for pregnant women, they also have to watch out they don't go overboard.
Yes. So some of the vitamin that we want to make sure they don't go overboard, first of all, is iron. If you have too much iron, that can be a problem. Now, most women, that's not a problem because our body able to kind of clear out the excess and just kind of get rid of it, so it's not become a problem. There are people with a certain diseases where the body cannot clear that, and that can be a toxic. Most of us, however, we don't have this problem, especially for women. Women, because they're losing blood every month, they tend to be more anemic. They tend to have low iron to start out. So it's very hard for them to kind of overdose themselves and take too much iron. Okay. All right. Thank you, everybody, for coming.